Hi, everyone. My name is Brooke Thaddeus, and I'm here today to talk to you about health and bioinformatics. Now, I recently graduated from George Washington University from their MHA program, which is Masters of Health Administration. You can also find me on Instagram and TikTok at Health Admin Life for more information on this field. But to tell you a little bit more, this field is really about improving healthcare outcomes by using data and technology. For example, doctors use data analysis to find better treatments for patients. And another example would be using electronic health records to keep track of patients' history to make better decisions for patient outcomes. And lastly, another example would be using technology like wearables for patients to keep track of their own health and wellness. For today, I really want to dive into what health and informatics is, the different types of internships and jobs and salaries that are available, as well as different educational pathways, and lastly, the challenges and opportunities in the field. Before I get into this, a little bit about me is, as I mentioned, I recently graduated from George Washington University. I have my bachelor and master's in health administration. I also recently have won one of the scholarships for Health Information Management and Systems Society, which is also known as HIMSS, which was a $5,000 scholarship. And I'll later get into scholarships for you all too. Now, I have internships and done previous internships with different health companies, and I am currently a healthcare strategist and consultant. With different internships and job opportunities, you can intern or work part-time in different health organizations like hospitals, clinics, long-term care facilities. You can work for different research institutions like universities and biotechnology companies. You can work for government agencies like CDH or NIH, or work for pharmaceutical and biotech companies or nonprofit organizations. Now, different jobs to look into would be health informatics analyst, bioinformatics scientist, clinical informatics specialist, health information manager, or medical informatics consultant. Now, you can see here, there's many different ranges for salaries, but to give you a little bit more about what these positions are about, let's dive in a little bit more. And for instance, for the first one, health informatics analyst, these professionals analyze data related to patient care and use this data to improve clinical outcomes. Number two, for bioinformatics scientists, they develop and apply computational tools and analyze data, including genomic data, which can help researchers identify new drugs and help with determining how to improve patient lives. Number three is clinical informatics specialists. These workers help healthcare providers to optimize their EHR systems, which is where all of your data gets held within the computer systems. And it really makes lives for doctors easier and helps patients access their data. Number three is health information manager. This is someone who usually works within a hospital system. They could be anywhere from a manager all the way up to a CIO. And they manage and store all of this data. So making sure that it's secure and that no one can break into this is so important for this kind of person. And for a consultant, which is one of the last on the list, a medical informatics consultant isn't someone who necessarily works within a hospital. They usually work for an outside company and they go into the hospital to try and improve their information systems. And with all of these, there's many different paths to get there, and you can major in different degrees. For instance, health informatics analyst, you could major in health informatics or related field, while a bioinformatics scientist may need a degree in biology or computer science or bioinformatics. So it's really important to talk to your counselors as well as different mentors to see what fits your goals and interests. Now for educational pathways. Now, most of you are in middle school, but thinking of the future, how are you going to get there? Now, you could do high school classes like mathematics, biology, computer science, statistics, chemistry, health science, or even IT. And what's important is you can do all of these, and you still don't necessarily have to go in this field, but these are such a great foundation for any career path. So I highly suggest taking these regardless. But let's say you do want to go into health and bioinformatics. In college, some different majors or even master's degrees you can consider would be health informatics, bioinformatics, computer science, biology, statistics, data science, health administration, or even public health. And it's important to note that there are other degree programs that are related to health and bioinformatics and can prepare you for a career in these fields. But it is, again, important that you research different programs and talk to your academic advisors to find the program that is right for you. Now, this is probably my favorite slide, and it's scholarships. And you're thinking, okay, is college right for me? And is this the right path? Is going to college the only option? It's not the only option. You can also look into getting certifications. But if college is the route, there are scholarships available. And these are 5 great ones that range from $1,000 all the way up to $40,000. And one of them I really like is the HIMSS scholarship. And if you want to learn more about it, please do feel free to reach out to me. I will put my information at the end of this. But again, look into these, see if you qualify. And at the end of the day, a lot of people may not apply to these. So you might have a better chance than you think. So please, please, please apply. You miss 100% of the shots you don't take. So go apply to these scholarships. For one of the last slides, we're looking into the challenges and opportunities within health and bioinformatics. Some challenges include data security and privacy, interoperability between different healthcare systems. And what this kind of means more is thinking of how one system can talk to another system digitally, and how can we interconnect these, as well as the ethical considerations for AI and machine learning. So ethical considerations when it comes to what is the difference between right and wrong, and how can we make sure that our technology is not biased. So that is something to think about going into this field, and how can you improve these areas. Now, for opportunities, it's also many different exciting opportunities, such as the potential for personalized medicine and bettering healthcare outcomes for everybody. This is such an important field moving forward, and so many opportunities. So there are a lot of jobs that you can go into. For example, machine learning and artificial intelligence can help doctors identify patients who are at risk for certain conditions, which help prevent diseases. Additionally, let's say going back to wearables like your Apple Watch can help patients monitor their own health and wellness to improve communication between patients and doctors. So there's so many exciting things going on that I absolutely love this field, and I really think that it's a good opportunity for you to go into moving forward, especially in the digital age. And on that note, to conclude, health and bioinformatics is so growing, and it can really revolutionize healthcare. And we've seen that in the recent years. And it's such an important field and can make a big impact in healthcare. There are so many different jobs, as well as many different educational pathways. Also, again, there are some challenges to overcome, and this is where you can make that change. If you really are interested in pursuing this career, I really encourage you to explore many different opportunities, different classes, different college degrees. And if you do have any questions, feel free to contact me, whether it's on LinkedIn, Instagram, or TikTok at healthadminlife, or feel free to email me at healthadminlife@gmail.com. It is spelled differently at HLTHADMNLIFE@gmail.com. But I want to thank you all for listening. I hope this really inspires you to go into this field. You'll make a big impact, and you'll also have meaningful career paths moving forward. So again, if you have any questions, feel free to reach out. Thank you.